Microcephaly, which has continually been a pretty unusual and poorly understood problem inside the well-known population, has lately received a lot notoriety because of its association with Zika virus infection at some stage in being pregnant. In this text we are able to provide an explanation for what microcephaly is, what are its primary reasons, its signs, the sorts of prognosis and the treatment options. Here, allows communicate about microcephaly in preferred, associated with several distinct sicknesses, together with Zika. In case you are searching out specific facts about Zika fever microcephaly, visit the following link: Zika febra, causes, signs, microcephaly and remedy. What is microcephaly? The size of the kid's head is without delay associated with the size of the brain. If the toddler's brain grows, his skull expands within the identical share. Our cranium is composed of 6 bones that at birth are separated via fontanelles, molares. This separation lets in the skull to make bigger because the brain grows. The mind actually pushes the bones of the skull, inflicting them to enlarge. This price of expansion is better within the first few months and gradually decreases over the years as the fontanelles near and limit the capability of cranium expansion. If for a few motive the fetus does not nicely expand the mind inside the uterus, it will be born with a smaller sized cranium than anticipated. These cases are referred to as congenital microcephaly. Microcephaly also can be received. A baby may have had ordinary improvement within the fetal degree, but the mind might also forestall developing after birth. Over the years, your toddler's frame will grow quicker than your skull, making your head look smaller than anticipated. Those instances that get up after beginning are referred to as received microcephaly. Early closure of the fontanelles, known as craniosynostosis, is any other feasible reason of obtained microcephaly. In this example, the brain does not develop due to the fact there is a dilemma of its bodily area. In most instances, microcephaly is associated with a postpone in intellectual improvement. In about 15% of patients, but microcephaly is moderate and the child might also have an ordinary or close to normal intelligence level. As already mentioned, microcephaly itself isn't always a disease, it's miles a sign of ailment. When a child has microcephaly, one should try to perceive the purpose in the back of this modification. We are able to talk specifying the reasons later. Standards for microcephaly. The definition of microcephaly used within the advent of this text is as simple as possible: a head whose circumference is smaller than the circumference anticipated for youngsters of the identical length and age. In exercise, however, we need a particularly extra special definition, concerning numbers or chances so that this comparison with the relaxation of the populace can be made. Traditionally, the medical definition of microcephaly has constantly been relatively complicated and tough to understand for the lay public. The 2 most commonly used settings are occipitofrontal circumference, COF, much less than 2 popular deviations beneath the imply or decrease than the 3rd percentile, slight microcephaly. Occipitofrontal circumference, COF, much less than 3 fashionable deviations under the mean, severe microcephaly. To apply the above criteria, one have to recognize the concept of popular deviation and have a desk with the circumferential occipitofrontal circumference curves for the various a long time, deliberating the traits of the populace in query. With the emergence of Zika cases in pregnancies, the prevalence of microcephaly elevated sharply, and the analysis needed to be simplified, at least for newborns. With a purpose to facilitating and increasing the detection of cases of microcephaly, the Arena Fitness Organization, WHO, has started out to advocate microcephaly as a simple measurement with a head circumference measuring tape, cranium circumference, as shown inside the photograph that opens the article. Boys with cephalic perimeter less than or identical to 31.9 cm or women with cephalic perimeter less than or equal to 31.5 cm are considered microcephalic. It's far crucial to emphasize that this criterion best applies to new child and complete-term children. This is greater than 37 weeks of gestation. This criterion isn't always beneficial for the diagnosis of acquired microcephaly or congenital microcephaly in preterm infants. Reasons of microcephaly. Several illnesses can purpose microcephaly, from genetic issues, to drugs or pills, all through being pregnant, to infections and to trauma. Under we will listing a number of the viable causes. Problems of genetic or chromosomal foundation, consisting of Down syndrome, Poland, Edward, Patau, Rett, X-connected microcephaly and numerous others. Headaches in the course of childbirth or in the course of being pregnant leading to loss of oxygen to the baby's mind, hypoxic encephalopathy. Craniosynostosis, early fusion of skull bones. Infections at some stage in being pregnant, such as rubella, cytomegalovirus, toxoplasmosis, syphilis, varicella, HIV or Zika. Meningitis. Use of teratogenic medicines at some stage in pregnancy. Maternal malnutrition. Consumption of alcohol in being pregnant. Drug use in being pregnant, consisting of heroin, marijuana, or cocaine. Smoking throughout being pregnant. Radiation publicity. Maternal folate deficiency. Maternal metabolic diseases, which includes phenylketonuria. Maternal poisoning by way of lead or mercury. Diabetes mellitus poorly managed all through being pregnant. Stroke inside the new child. Despite the fact that the above listing is big and no longer complete, many cases of microcephaly emerge as being left unidentified. This commonly happens because they're caused by genetic abnormalities whose research is not available at their location of residence, or with the aid of inadvertent publicity to harmful substances or by prenatal infections that were now not recognized throughout being pregnant. Signs of microcephaly. The sign found in all instances of microcephaly is a small head, of a size disproportionate to the body. Microcephaly capable of causing retardation in intellectual development is regularly quite obvious on bodily examination. Some sufferers with moderate microcephaly do now not have some other signs or symptoms aside from a head. This is less than the common of the populace. In those instances, known as remoted microcephaly or microcephaly vera, intellectual capacities can be almost or absolutely preserved. In most instances, but, microcephaly is observed by other signs and symptoms, whether or not they stem from negative brain development or from the syndromes themselves which have impeded proper boom of the mind and cranium. Relying on the severity of the accompanying syndrome, kids with microcephaly may also have late highbrow improvement, postpone in speech development, delay in toddler developmental milestones, sit down, stand, move slowly, stroll, motor incoordination, muscular rigidity, spasticity, imbalance, facial distortions, bodily adjustments normal of the genetic syndrome of which the affected person is a provider, including Down syndrome, as an example. Brief. Hyperactivity. Convulsive crisis. Visual or auditory deficits. Analysis of microcephaly. The prognosis can be made even for the duration of being pregnant through fetal ultrasound, that's able to degree the scale of the fetal skull. The quality time for this assessment is on the cease of the second trimester. For the duration of the examination, this is generally known as morphological ultrasound. Even though fetal ultrasonography is normal, the infant's head circumference must be measured 24 hours after start. If you are normal, your pediatrician have to keep measurements during recurring appointments till the kid is 2 years antique and your fontanelles are closed. If at any time the pediatrician suspects microcephaly, the child need to be cited a specialized pediatrician. Some imaging tests, which include magnetic resonance imaging, can provide essential information approximately the toddler's brain shape, helping to verify microcephaly, and provide guidelines on its viable causes. Treatment of microcephaly. Although there's no cure, there are treatments that assist limit the troubles as a result of microcephaly. As already mentioned, infants with slight microcephaly typically present no other troubles than a small head. These cases simplest want tracking, and no unique treatment is needed. For babies with craniosynostosis, there are surgical procedures that assist detach the bones from the skulls, permitting the brain to grow without regulations. In children with more intense cases, the treatment objectives at controlling the related symptoms and signs and symptoms, which include muscle stiffness, seizures, delayed speech improvement, etc. The neurological prognosis is at once related to the diploma of microcephaly, being worse in patients with occipitofrontal circumference underneath 3 trendy deviations underneath the imply and in people with microcephaly caused by more extreme genetic syndromes or infections in the course of pregnancy. Do you know that stem cell can regenerate you cells and cure you of more than 200 diseases? To get to know more and get the products for use or sales, check in the description, and please subscribe to our YouTube channel and share to others.